So hello to everyone and welcome to this week's blog. Since this pandemic started, our people and teams across the province have done some amazing things, and we've been sharing many of these stories with you in my blog. Today, we're going to have a discussion about our COVID-19 assessment centers. Our first assessment centers opened in Calgary and Edmonton on March the 7th, only 2 days after the first recorded case of COVID-19 in Alberta. Now we have more than 70 active drop-in and drive-through centers and testing sites across the province. They provide rapid screening and testing for COVID-19 for all Albertans and help coordinate the collection of specimens while ensuring the safety of the public and healthcare workers. Testing helps identify how active the virus is within our communities, how many people may be infected, who they are, and where they live and work. Every test completed is like a piece in solving a puzzle. Expanded testing enables us to root out the disease, trace its whereabouts, contain the spread, and get patients the help and treatment they need. And now with the online booking tools for Albertans and healthcare providers, it's easy for them to schedule a COVID-19 test at the center closest to them. This is essential as it helps address the increased demand for testing and reduces the amount of time people wait for a test. We've completed more than 650,000 tests across the province at all these centers and sites. This is an incredible amount of work and gives you a little bit of the window into how busy these places are. So to tell us more, I'm joined by 5 guests from across Alberta. Laura Blahitka, who's the Executive Director for Community Health Services in the Calgary zone and will be celebrating 40 years of Alberta Health Services next year. Leslie Gwatz, who's the Director of Operations for Public Health in the Edmonton zone, who's been with us for 25 years. Shauna Wilson, a licensed practical nurse in Red Deer, who's been an LPN for 20 years. Want to wish her congratulations and advancing to be an RN, and she's been with the health system for 8 years. Tracy Hansen, who's a registered dental assistant in Lethbridge, it's been with us for 22 years. And Patricia Nordstrom, who's a manager Public and Population Health in Grand Prairie, who's been with us for 15 years. So greetings to you all, and thank you so much for joining me. So Lori, I'm going to start with you. I gave a quick history about the assessment centers, but I want you to tell me a little bit about what's involved in setting one up and what are some of the challenges.
I think for me, one of the most positive experiences in setting up the assessment centers in the Calgary zone has been the incredible number of people and departments that I've had the pleasure of working with in setting up these assessment centers. It's not only the public health staff and the healthcare workers that collect the swabs that are involved, but just a multitude of people that help us. And it's been a really great partnership. We've been working with departments such as space management, corporate real estate and leasing, Alberta Provincial Labs, communications, IT, workplace health and safety, IPNC, just to name a few, supply management. I'm sure I've forgotten many, but it's just been a real collaborative effort to get these assessment centers set up. Safety of our patients and staff really is the priority. And so we spend a fair amount of time together trying to identify potential sites that will have optimal traffic flow that's safe, and also give our staff enough room so that they can collect the swabs and still have sufficient space to meet IPNC guidelines. It's been a real large learning experience for us in developing our HIACs for each site, especially when they're not AHS locations, and trying to identify all the potential hazards and all the control measures that we have to put in place to manage those risks. We've had to consider all the potential adverse weather conditions. When we first opened up in March, we were dealing with snowstorms and freezing temperatures and wind, and this past week we've been dealing with heat warnings in the Calgary zone. So we've really had to think about lightning and tornado warnings and many things we don't normally consider when delivering public health services. We've also had to learn a lot about preparing for medical emergencies in the lineups and dead car batteries in our lineups, which we never really thought about until it happened at some of our first locations.
Leslie, just moving on to you, maybe tell us a bit about the difference between walk-in and drive-through assessment centers and how we protect the health of staff and patients at both.
The obvious difference that the drive-throughs involve clients staying in their vehicle for the entire encounter. So they are ferried in through into lineups, queued into lineups, and then into the building, whichever that is. In our case, it's an eco station, and they receive their service in the eco station, and then they're directed out. All of that happens with staff from our actual partnership with the county. They have all of the safety pieces in mind to make sure that traffic isn't jamming up and to make sure people are staying in their vehicles, because it can get quite lined up and we wouldn't want folks wandering around. In terms of safety for our clients, the clients really prefer the drive-through, we've found, because they're in their own environment. They don't need to get out. They can stay contained in their car. We don't actually require them to wear a non-surgical face mask if they're in their vehicle. They're welcome to, and many do, but it's not the same as if they're coming to the in-person clinic, where we're actually seeing hundreds of people at a number of stations inside one space. In both cases, our staff are in full PPE all the time. So they have gowns and gloves and the non-surgical masks and face shields. And in this heat, you can appreciate that that's quite something for them in the drive-throughs. In the in-person stations, they are all provided with a non-surgical face mask when they arrive if they don't have one, and they wear that for their entire time in our building, and then they can take it off when they leave and put their own mask back on if they have one with them.
Sean, now there's a lot of us who don't know what it's like to work in an assessment center. So maybe give us a bit of a rundown.
So in Red Deer specifically, we have a drive-through assessment center that we call the External Assessment Center, or we call it the EAC. And the site of the EAC in Red Deer, it was a vacant car dealership. And the service bays have been transformed into a 6-vehicle drive-through center that we used to collect the COVID swabs. Our role at the EAC is that we would don our personal protective equipment, or our PPE, and then we go out into the bay and we greet the client in their car and assess them. We return back to the doorway, and the administrative assistant will hand us the swab. We go back to the client, confirm the client demographic information. We collect the swab, go back to the doorway, and the administrative assistant is there with a collection bag. We drop the sample, and then the client drives away. We go and doff our PPE, and we repeat the process over and over and over all day long. So it is a very long day and very fast pace. I find, as a nurse at the EAC, collecting the COVID swabs, it isn't the only skill that we're performing. Many clients who come through the center are very thankful, and they're expressing gratitude, but we also have some clients that come through and they have, worries, they're expressing, fear and anger. And so the nurses, or us there, we are there to assess and inform and comfort and offer a comprehensive client-centered service.
Tracy, you're a registered dental assistant in your regular day-to-day job. So obviously you've been able to transfer the skills that you have from your profession into something like working in an assessment center. So maybe share with us about what that's been like.
Working at the assessment center has been very busy. I can't believe how fast these last months have gone by. It has been challenging because of all the new protocols that are always coming up. The nice thing is that being a dental assistant, I've been able to transfer my almost all of my skills over to working in the assessment center. With dental assisting, we work with a lot of people who are really frightened, when they're coming to get dental work done. Well, people are frightened when they're coming. Sometimes they're anxious. We're able to help them feel a little better, calm them down. We IPC, PPE, admin support. We do all of those things in our dental when we're working as dental professionals with Alberta Health Services.
Patricia, what's your role in managing the drive-by testing site in Grand Prairie, and how has that experience been?
My role in managing the testing site in Grand Prairie has been largely focused on ensuring that staff have a safe workplace, and also to address all the questions and issues that have presented since the start of the pandemic. Across the North Zone, we don't actually have designated locations for testing, so most of us in the North Zone are doing it right outside the back door in our parking lots. Of course, that has its challenges as well when it comes to weather, and so constantly we're looking for ways to be creative and address the challenges of weather and anything else that comes up. So we've managed to do that. In Grand Prairie, we've moved from swabbing in the parking lot to swabbing under ATCO tents to swabbing in the basement parkade of the local library, which has been quite successful.
Now back to Laurie and Leslie, and with the recent surge in cases, we know there's an increased demand in testing. So Laurie, I'm going to start with you.
We typically manage increases in demand by either adding or extending shifts at all our sites. This week, yesterday actually, we added our 8th testing site at the Stampede to meet the growing demand for symptomatic and asymptomatic testing as a result of the increased number of positive cases in the province. So the Stampede has been our largest site to date. We've got a capacity to do 2,000 swabs a day at that site. Up until we opened Stampede, we've had an overall capacity of about 3,000 swabs a day in the Calgary zone, but have typically done about 2,500 on average people a day. When we first opened on March 7th at our very first clinic at Richmond Road, we tested 156 people in one day, and we were so excited. But yesterday we broke our record and tested over 3,300 people in one day. So I'm really proud of all the staff that have stepped up, and especially in the last few weeks. And just to give you our final stat, as of yesterday in the Calgary zone, public health alone in our assessment centers have swabbed over 209,000 people in the Calgary zone. So I'm just incredibly proud of all the people that have stepped up to help us.
We hit a bit of a peak towards the end of June, and we really had to ramp up our in-person site. We had about 20 stations at our in-person site, and as it was ramping up, one of our drive-throughs was closing down. So we ramped up to 35 stations in our in-person assessment center, and have run pretty much 35 since the end of June. And that's a combination of appointments and drop-ins. So depending on how the lines are moving, we can ebb and flow the staff to manage more drop-ins or more appointments. Our drive-through site, we took a look at our efficiencies and really tried to streamline our processes, and learned that we could actually see more than we were seeing in an hour per swabber. So our drive-through site can see 8 to 10 vehicles if we really have them nose to bumper. But we can get through about 10 folks per swabber per hour. So that's our benchmark for both of our sites. So our drive-through has capacity for about 700 people in a day, and we typically see about 600. There's a fair number of no-shows, and that can be a challenge because it's difficult to see that capacity go unused. And in the in-person assessment center, we have capacity for 2,500 and typically are seeing about 2,000 in a day. The other thing we did to support the increase was, as been mentioned, we really began to lean on our partners. Our dental staff became trained and we're champions, and our allied partners have just been outstanding at stepping up and being right on the front lines. It's been a wonderful partnership and a great collaboration for us across our portfolio to actually work beside and with people that we don't always have the same opportunity to work with. So that's been awesome.
A final question for our 3 guests who work at the front lines. So in a few words, what motivates you to work at the assessment center? We're going to start with Shauna.
something that motivates me to work at the assessment center is my desire to serve the clients in the community. As we've been in the middle of a pandemic, I want to do my part to protect the public and to help stop the spread of COVID-19.
A couple of things that really motivate me is that I get the chance to work with so many different people. I get to work with occupational therapists, language pathologists, LPNs, dietitians. We're all working together, RNs and admin. We work together, people that I would never work with before. It's been such a great opportunity to work with these people, for sure.
The entire public health and population team have been amazing. Everyone has stepped up to the plate. They've persevered through all sorts of challenges. Their commitment has motivated me to give them the best support that I can to make sure that we are serving the community and they are safe and enjoying their work. So I would have to say it's the team that motivates me.
Well, thank you to all of you. This has been an awesome conversation. Thanks for giving us an opportunity to learn what you're doing in the assessment centers, and really thank you for your dedication and amazing work, because without it, we wouldn't be able to protect Albertans, our patients, and each other. I just want to now take a moment to talk about the importance of continuous masking. The recent increases in COVID-19 cases is more important than ever that we wear our medical masks in all patient care areas and any place, including corporate areas where we can't maintain 2 meters of distance between individuals. This, along with continued hand hygiene and wearing personal protective equipment, will go a long way toward reducing risk and protecting patients, staff, and visitors. It's also important to protect yourself and others outside of AHS facilities too. So you may have seen these on Insight already, but now we have cotton, non-medical masks in the AHS store. So I'm just going to show you. It's a great mask, it's very comfortable, 2-ply cotton. The masks come in packs of 2 and are branded with the AHS logo, as you can see here. And I think I ordered somewhere, I think I've got the penguin on the other side. So whether it's our AHS mask or another quality mask, I really encourage you all to wear one when you go out into the community. So thank you for everything that you do, and we will see you next week at our weekly blog. Thanks again, everyone.
Together, we do amazing things every day.